So preventing Tui Na, Tui Na is TCM massage. Tui Na is TCM massage. It's different with Western massage. So thus we still follow the channels. And we still follow the points. So that's we call Tui Na. Sometimes we call Tui Na massage. So that's use hand, do some working. Tui is push. Na is picking. So that's the technique we use for Tui Na massage. For sure, we are not only push or pinking. We have more technique. Look like a pretty safety. It's not a needle go in, but still sometimes cause some advanced situation happens. So that's for today, we're talking about how to preventing it. So that's we're talking about already. What is Tui Na? Tui Na is a kind of work, kind of treatment. We have lot of technique inside, manipulation technique inside, like we see in the video, In different part of the body, we truly can use different kind of technique. So that's basically Tui Na used in China for many years. It's a pretty long history we use, and we can treat a lot of kind of condition, but mainly for relieve pain and mainly working for like muscles, bones problems. So that's the technique we're talking about. We use in Tui Na. This one they call Die. Like use your hand pinching the points. That's we see. Upper down, that we see in the video already. And these they call Bai. With the those side of the hand rolling. With those side of the hand is rolling. This one we call Ni. Like use one hand or two hands together. It's pinching, and that's pinching. This one we call An. Put some pressure, put some pressure. Certainly you still can use one hand or two hands pinching, pressure there, pressure down. And this one they call 指正. Means use the hand. 指 is the finger. 指 is the finger. Use the finger. Make some like a trauma in there. 正 is kind of make some trauma in there. So put a special part of the body and make some trauma there. This one we call 滚. Still rolling, still rolling. With the side of the hand is kind of rolling there. This one is Tui. Tui is pushing. pushing down. This one is G. Like use the fingers. Let it be faster go down to special part of the body. So that's basically 8 techniques there. Certainly we have more. Yes, certainly we have more. So that's basic 8 technique. Like the video we see, it can use for different part of the bodies. And basically we moving qi, moving blood, that can help. So we say Tui Na is pretty traditionally TCM technique. It happens in thousands of years ago. Yeah, we still have some like classical book. They tell us some technique. So like this one, this hand is doctor's hand. And this hand is doctor's hand also. This hand is patient's hand. So use 2 fingers, index fingers, go to special points, and they will have some special name for it. That's the technique. And this one, this still patient's hand. This still doctor's hand. So this technique basically used for children. And the pushing way from the hand to like a pushing, follow the channel there. So we have a lot of pictures like this coming from the Asian book. So like this one go to the height and some pushing and rolling in there. So that's go to like a bladder channel, bladder 2, bladder 3, some pushing there, help relieve height problems. And this one still for the hand. This one still for the hand. So these still for the patient's hand and arm. That's doctor's hand, doctor hand. So pushing to some points, and then like a moving, swinging the hand here. So we can see a lot of the picture like this. And another one, another one still for the height. Another one still for the height. That's mainly go to our points, 太阳. We have actual points of 太阳 there. So basically this technique uses 2 thumbs from 太阳 moving to the ear. So that's for some technique we coming from Asian time. From the video we see that's Tui Na we can do for the whole bodies for sure. That's video. Also we can do for the locally. Like people have local troubles, like a shoulder pain, knee pain. We can especially working for that part, especially working for the shoulders, for the knee joints or ankle joints. So we can especially go to locally. But be careful, we're talking about generally say Tui Na massage is a pretty safety way to do it. But we still need to be careful. Some kind of situations, we couldn't do it. The first situations, people got injured. like acute injury. Their skin is broken, the wound in there, still open there. We are not directly working for there, like people falling down and injure their ankles. We can do something around the ankles, but not directly go to that, like very swollen there, and even skin broken in there, we are not directly go to there. So basically, acute injury, even if we directly working there, maybe caused more swollen, more painful situation. You can do something around it, but not directly go to it. So that's the first situation we need to be careful. And then we still talking about the patients. Yeah, the patients, the general body conditions is pretty easily caused bleeding. Like they just touching for the table, they got bruised. They touching, they hit the wall, they got bruised. So that kind of patient, we try not to do Tui Na because they are pretty easily bruising. Like if you use some power in there, like a bruising everywhere. Yeah, so that kind of patients, patient have illness. Generally say it's blood illness. Yeah, blood stop bleeding like a platelets illness. These kind of patient we are not used. And also, patient have skin issue. Like a skin illness, yeah, skin illness. Skin illness, some skin illness may be caused by like a bacterial infection or fungus infection. It pretty easily transmit like from one part to another part of bodies, like a lot of skin rashes in there. So that kind of situations, we are not touching there and we are not like do massage, do Tui Na for them. So that's skin issue kind of patients. And then we talking about acute infection kind of illness. Acute infection kind of illness, generally patient will be fever. Fever and maybe locally some redness, swollen, and painful, swollen, and painful. So that kind of patient, we are not to do Tui Na for them. So that's basically like a bacterial infection or virus infection kind of illness. It's kind of body 正气 very different in there. So we are not use Tui Na like make more damage 正气 there. And the Tui Na not 出来 treat infection kind of illness. We say Tui Na mainly we're working for the muscles and the joints. We are not truly treat internal organs disorders. Then we talking about the patient have like a severe kind of like a brain disorder or maybe heart disorder or maybe severe kind of liver disorder or kidney disorder. So basically, Severe kind of internal organ disorder, we need to be careful. Yeah, we need to be careful. Maybe something happens during our treatment. Like a patient have a heart issue. Even they don't do Tui Na massage, still possible got a heart attack. But when we do like a Tui Na for him, maybe even trigger the problems. So we're talking about the severe kind of organ disorder here. Basically, by Western medicine aspect, they got clear diagnosis already, like a heart failure kind of patient, liver cancer kind of patient. So we need to very, very be careful, very be careful. Then we're talking about during menstruation time and pregnancy, we still need to be careful. We are not say totally we couldn't do it, but we need to be careful. Menstruation time, people blood flowing more faster, like losing blood kind of difference in there. We need to be careful to do it. And for pregnancy, pretty similar we talking about before. Especially lower back and abdominal area. We couldn't do for pregnancy. Lower back and abdomen. So that's, we couldn't put the needle there. Yeah. No needle, no cupping, no massage, no Eastern machine, no Tui Na. Yeah. Nothing do on the lower back and abdominal area. Because that's truly we still can trigger more blood and qi circulation in there. Maybe cause the miscarriage. Yeah, so that's especially for pregnancy, we need to very, very be careful. Yeah, very, very be careful. And then we're talking about still locally. Yeah, locally abscess. That still belong to like bacterial infections and cause like abscess in there, some parts inside, and also tumors, yeah, including mainly is the cancer kind of tumor. Yeah. So we are not to put pressure over the abscess, maybe cause the like infection go to ejected air. And also we are not put pressure to the tumors. Pressure to the tumors maybe easily cause like cancer kind of cells follow the blood circulation, go to other part of the body. So that's some special situations we need to be careful when we do Tui Na. Yeah, when we do Tui Na. So certainly Tui Na we can treat for whole body, or maybe we can treat for locals. We can like the patients lay down there, and we can like patients sitting there. That's mostly. Then we talking about how to preventing. Something possible happens for Tui Na treatment. So we still need to follow clean needle technique. We're talking about washing your hand before the treatment. And also, we are especially pay attention local area if they have skin infection in there, like acute skin infection locally, redness in there, swollen in there, we are not directly working for that area. And the patient have injury and got a wounds in there. We are not directly working in there. And we talking about before, patient have broken bone kind of condition. We are not directly working there, not directly working. Because the broken bone, basically, they can healing later. Sometimes we need to go to doctors. Like if the broken bone, they are not dislocations, they can healing by itself later. If got dislocations, go to doctors, they will give it kind of relocated and together. And they may use something covered there, fixed there. So that kind of condition. If we're working for that area, maybe we make it a dislocation again. So that's pretty easily like make it long-term, not healing. So the broken bone, we are not directly working there. And acute trauma, still locally runny, swollen in there. We are not directly working there. So that's basically, and also pay attention, some cancer kind of patients. Maybe during the treatment, maybe like after surgery. So that kind of patients, we need also more pay attention. And basically not too strong manipulations. And also we try to make a recorder like each of the treatment, just in case. So that's some aspect we need to pay attention when we do Tui Na treatment. So we follow the ruler. We talked about already hand sanitizer. Wash your hand first. Wash your hand first before to do any kind of treatment, including Tui Na. Certainly we know, like we do acupuncture, we need to wash your hand. We do massage, we need to wash your hand. But even we do Tui Na, we still need to wash your hand. And then we say, don't do Tui Na in the air, skin issue, and the local damage area, not healing yet. So that's some basic ruler here. And also, stronger recommend. Pay attention to pressure when you do Tui Na. For different kind of peoples. So like aging peoples or younger peoples, not too stronger, I mean it's children's, not too stronger pressure in there. Patient have different kind of condition, and the patient aging patient or very, very small children, we are not too stronger pressure in there. And also including the Tui Na locations. Some locations we couldn't put too much pressure in the chest area, even neck area, not too stronger pressure in there. And also follow patient's body constitutions, pretty similar like we talking about the agings. Patient generally is different, very different kind of patient. We are not too stronger pressure for there. And then pay attention. If patient have some severe kind of organs disorder. We are not put too stronger pressure for them, just in case. Yeah, just in case. So that's basically some rule about our safety part. Yeah, about our safety part.